in the wake of that very difficult psilocybin experience, I was just too scared to trust anybody again in a guided experience. So I read the MAPS protocols. This is the Multidisciplinary Association of Psychedelic Studies. And I replicated it at home. And, what the series of trips that I did were just some of the most profound experiences of my life.
Welcome back to the podcast. Today it's Alex and I'm speaking with Rose Cartwright. Rose is an author and a screenwriter. She's written a book about her experiences with obsessive compulsive disorder, which is called Pure, which subsequently became a Channel 4 television show by the same name. Rose is also a screenwriter and she's currently one of the writers on the upcoming Netflix sci-fi show Three Body Problem. I really enjoyed talking to Rose. We had a conversation about her experiences with OCD and really how she moved through different paradigms to better understand her experiences. So in this conversation, aside from discussing things from a medical point of view, we also discuss things from a psychological point of view, a trauma-informed point of view, and even a spiritual point of view. A couple of things worth noting about this conversation. We critique the medical model quite a lot, but despite that, if someone felt they were having experiences akin to obsessive compulsive disorder or something similar, that doesn't mean I wouldn't recommend them seeking medical attention, but rather I would urge them to seek medical attention while at the same time keeping an open mind, doing their own research, using commonsensical means of helping themselves feel better, and also getting support from family and friends. Secondly, we talk a lot about Rose's experiences with psychedelics. And again, even though there's value to be had from that conversation, I wouldn't recommend that anyone do psychedelics by themselves without appropriate medical supervision, such as during a clinical trial. All that being said, sit back, relax, and enjoy this conversation with Rose Cartwright. I'm delighted to be joined today by Rose Cartwright. Rose, thank you so much for coming on the program.
Thank you, Alex. I'm really excited to be here. I'm a big fan of the show, regular listener. So.
Oh my God. Oh. I've just finished your book this morning.
Wow. Okay.
And I thought it was wonderful for lots of reasons. Obviously, for anyone who might be experiencing OCD, or anyone who's curious about it. One of the things that interested me in it is I saw how you moved through different paradigms. And for you, it was a very slow, incremental journey. There were some landmark moments. The first time you discovered the concept of intrusive thoughts, the first time going to some kind of therapy, trying different medications. And it's like you escalated through different paradigms and went deeper and deeper. And from what I understand, after the book, you've still continued to go deeper. So I'm really curious about that. Maybe you could talk a little bit about kind of more of a bird's eye view, what that journey of discovering what OCD was for you was like.
Of course, yeah. That's nice to hear you just finished the book because it's, I haven't read it for quite a few years. Mm-hmm. I'm probably due another read. It's kind of weird reading your own work back. But I published the book in 2015, and that was an expansion of an article that I wrote that had come out a couple of years before, which was the first time that I'd ever written about intrusive thoughts and that kind of OCD. And the sort of going way back to when these strange internal experiences started happening for me, I was 15 years old and I started experiencing very distressing, intrusive thoughts of a sexual and violent nature, unlike anything I'd ever experienced before. I was still a kid, so I didn't have any vocabulary to explain what I was experiencing to anybody. Even if I had, I think I would have been too frightened to, because I thought that I was some kind of monster. And for anybody that doesn't have OCD, it may be maybe you can't quite imagine the frequency of the thoughts, but we're talking like, intruding on every minute of every day. It's a really debilitating and devastating condition. Only, this was way back in the early 2000s, and there was just no public awareness about the fact that OCD can manifest in that way. And it was a really grueling more than 5 years until I was at university when I found that out myself. And in that time, I was just sitting with this internal world of terror, really, and not telling anyone about it. Yeah. The thoughts were often of a very visual nature. So they sort of intruded on all of my socializing, all of my intimate moments. Every landmark of my adolescence and my growing up was kind of destroyed by these intrusions. And I think just slowly, by being online and sort of shyly reading forums, I started to realize that other people were having these experiences. And then I started talking to doctors about them. And then I finally arrived at this diagnosis of OCD.
And importantly, you arrived at it.
I arrived at it. I sort of recognized my experiences in the descriptions that other people were posting online. I was like, oh shit, I'm not the only person in the whole world that experiences this. Yes. And I took that self-diagnosis to doctors and I had it corroborated. And from that point on, for me, the diagnosis seemed to help in terms of, okay, this is a thing. It's not my fault. There's a reason that this exists.
And it's interesting because even just discovering the phrase intrusive thoughts, it is one of those landmark moments in the book where it helps to capture some truth of what's happening, because before, if you're experiencing these intrusive thoughts and images, if someone with OCD they don't know what it means. That's the thing of it. If they're having thoughts, for example, that around children and pedophilia, or thoughts around sexuality, or thoughts around contamination, we're not really taught what relationship exactly should we have with our thoughts. Should we take every thought we have extremely seriously? Is every thought we have a statement about who we are? And that's really what you struggle with in the book.
It is. And, since I discovered this idea of intrusive thoughts, and since I got into meditation, I've actually realized that in a way all thoughts are kind of intrusive, in that we don't we're not the authors of our thoughts and we don't control them. But that was kind of news to me back in my early 20s. I thought that because these things were in my head, that was somehow proof that they must be speaking from some deep innate part of me, and they must be indicative of some kind of desire or volition, which is what people with OCD stumble on, is like, well, this must be true because it's happening in my head. We're very wedded. We build our sense of identity around our thoughts. And a big part of me getting better was breaking down that identification with thoughts.
Exactly. And in that way, I think what people with OCD can teach everyone else, and this is something I discussed with David Veal, is we don't have to identify with our thoughts. As you said, our thoughts kind of arise spontaneously out of the ether. Who knows where they come from? And what you learn through meditation is that you are not your thoughts. You are what you could call in Buddhist circles the witnessing consciousness. You're something separate. You're also something separate from your emotions, which is also important because people often over-identify with their emotions. And I think when you start to form that relationship with your thoughts and emotions, they stop being the things that run you, and you can actually use them as tools. And sometimes they're really useful tools, thoughts and emotions, and sometimes they're not. But I guess in OCD, you're kind of being dragged around by your thoughts, and then they feed into anxiety, emotions.
Yeah, I mean, I agree with everything that you've just said, and I've witnessed that very thing in my meditation practice. The difficult thing for people with OCD, those insights are very difficult to get at because our nervous systems are on high alert almost all of the time. So it's actually, that practice of sitting down and noticing what's happening in your mind and your body. That's a very, very, very big ask of someone with chronic and very serious OCD. It's very challenging, and I feel like it's almost counterintuitive, and that for someone with OCD, it's difficult. Oh, well, what do you mean these thoughts aren't me? They're happening. You know, it takes a lot of practice to sort of break down.
Yes, I think it's counterintuitive for anyone, but let alone if you have OCD and thoughts play such a huge part of your mental life. But what I'm curious about is, so would you say to get to a point where meditation is an option, you first have to go through some more cognitive behavioral steps?
I think everyone's path is different, and I don't necessarily think just because someone has a diagnosis of OCD that necessarily tells you what kind of therapeutic path they need.
Yeah.
You know, my discovery of meditation, I don't recommend anybody does this. I kind of like jumped in, having not meditated at all, into a 10-day silent meditation retreat when I was extremely unwell. Because I was at my wit's end, and I hadn't, I felt like I didn't have anything else to try. I actually felt like I'd sort of exhausted everything that CBT and exposure therapy had to offer. And I just thought, fuck it, what else is out there? So I kind of hit myself over the head with meditation, and that can actually be quite dangerous, I think, for people with OCD or people with trauma, because if you sit down and pay attention to what's going on inside, that can be a very triggering thing.
Yes.
But
so you went in at the deep end.
I went in at the deep end, yeah. And it was an incredibly valuable experience, and one that I'll never forget. It's a very confronting thing to sit in silence for 10 days for anybody, let alone for somebody who has a mind as busy as mine. So
how did it go? What was the retreat like?
The first 3 days were absolutely horrendous. I was actually crawling out of my skin. I couldn't sit still. Everything in my body hurt. As usual, my intrusive thoughts were just flickering through my mind almost constantly. My anxiety levels were extremely high. I was like, what am I doing here? What have I done? And then, and this has been true of my experience of meditation retreats since. They've followed a similar shape, but sort of by day 3, the body sort of kind of, it just says, okay, then.
Yeah.
All right, here we are. Like, here's this suffering. And, the Buddhists, they're big into their sense of suffering and their dukkha. And it's not the suffering itself, it's our struggle with the suffering that is the problem. And the system sort of quietens down a little bit after a while. And it did for me. Then some very interesting things started to happen. I actually had what I can sort of, what's still embarrassingly call a kind of both a mystical experience, a kind of peak experience, almost like a psychedelic-like experience of there being no different between the subject and the object of my consciousness. There was just sensations, just sight and sound. Non-duality, a sense of like the boundaries of the edges of my body eroding, and sort of like a feeling of like boundless love. And that lasted like 90 minutes. It was bizarre. It was absolutely bizarre. And, that's not necessarily typical of, someone's first meditation experience, but it also does happen. I didn't realize that at the time, but these kind of peak experiences or non-ordinary states of consciousness, they're sometimes called, they do happen. Through all sorts of things, whether it's meditation or breath work or obviously psychedelics, but, sometimes through music, dance, sex, like these, these states happen.
Yes.
And it happened for me. And then I sort of, why it was so significant was that for the first time since I was 15 years old, I had an hour and a half where I didn't have a single thought. And that was like peeking behind the curtain.
Yeah.
I was like, oh wow, there's a way of existing beyond my OCD.
Yeah.
And that, we're talking about landmark moments in someone's journey. Like that was a landmark moment. It just really just blew my mind. And I realized that there was a me somewhere beyond all of this. And I came back and I started reading about peak experiences, and I got really curious to find out that, there are studies into the brains of meditators, and that their brains can often look quite similar to the brains of people who are taking large doses of psychedelics. So I got very curious, and I just thought, well, what was that? What had I just experienced? What was that state? And that sort of path of questioning eventually led me to using psychedelics as a tool to explore my consciousness as well.
I'd love to get on to psychedelics in a moment.
I did tell you I've got a tendency to waffle.
No, I mean, that's why I love podcasts.
Okay, yeah, same.
And that's why this isn't a 5-minute YouTube video.
Okay, good. Yeah, we've got
the 5 steps to breaking through your...
Yeah.
Okay.
I have no structure to offer you. I'll just talk at you.
Yeah. I think another really important part of your book, as you proceed through these landmarks, the last landmark is this realization that a lot of what the OCD was for you, it sounds like, is the struggle with uncertainty. Like how much uncertainty can we tolerate? And this need to achieve this kind of perfection. I related to so many parts of your book. I think we might be a similar age because I recognize the metronomy and the rapture. The only difference is I went to Beni Kazim in 2008 rather than 2006.
Okay, there you go.
But one thing I relate to hugely was this constant duality where you're having fun with your friends and your mind is telling you, this is what you should be doing. This is the level of happiness you should be feeling versus the level of happiness that you actually are, and that private sense of isolation. But towards the end of the book, you get to that point where actually all of this struggle has been about, can I tolerate uncertainty? And the way your compulsions, subtle as they were an attempt to generate certainty about yourself in the past, present, and future. And maybe you could tell us a bit what that was like.
Yeah, I mean, the kind of thoughts I was having, well, the themes of my obsessions changed over the years, but one consistent theme was around my sexuality and whether or not the intrusive sexual thoughts that I was having meant something about my sexual identity. And I sort of felt quite confident in writing about that, even though that kind of OCD hadn't really been written about much before, because I think everyone knows what it's like to have intrusive thoughts of an uncomfortable nature and to struggle with sense of identity. Just with OCD, it's just the volume's turned up to the max. And yeah, I mean, in terms of embracing uncertainty, CBT did help with that to an extent.
Yeah.
And exposure therapy, because you're sort of constantly hitting yourself over the head with fears about what you think might be true. And you're constantly prompted, rather than to engage in compulsive behavior to try and figure out whether or not it is true. It's like sort of just to sit with that uncertainty.
Yeah.
And, that was helpful for my OCD, but it was also just a really helpful life skill.
Yeah.
And it sort of maps with the practice that you learn in meditation of sort of grasping all these internal phenomena lightly, whether it's a thought or a physical sensation, is just, the practice of non-attachment. And
allowing the thoughts and emotions to wash over you rather than to grip you.
Yeah, exactly. Yeah. But again, it's a very difficult thing to do. And I think I sort of, at the time, kind of underestimated how big a job that was. And I think accepting uncertainty is not just a cognitive task, it's a somatic task. And when I wrote Pure, I wasn't really versed in any kind of language of the body, and I didn't really understand that these thoughts were actually tethered to very specific physical sensations in my body. And the real acceptance didn't really come until I started to learn to tolerate extreme discomfort in my body. And I found that I needed tools that worked on a deeper level than CBT does.
So when you were working with because you went through a few different therapists, and I was quite when I was reading the book, I was quite scared actually, because you see all these well-meaning health professionals, many of whom importantly miss the mark. And I'm a well-meaning health professional, and I don't want to miss the mark. So it was a bit scary. But you went through different paradigms where you had therapists who were like, you just challenge the irrational thoughts with rationality, and of course that serves to feed that cycle. And then you were seeing your American therapist. Was that cognitive behavior therapy?
That was quite an aggressive form of CBT.
And that's where you reached that landmark of being able to deal with uncertainty and develop a relationship with uncertainty. And it sounded like that worked well. And then you decided to go deeper, as you just alluded to. And I'd like to just mention a quote from an article you sent me, which I thought was beautiful. So you said, speaking about your journey thus far, I was raised to think about my suffering as pathology. I was given a semantic field of diseases and cures and pills, definitions with hard edges. Maybe I bought into that way of seeing because it gave me discrete linguistic containers, an established framework within which to write and talk. But that framework could not contain my experiences for long. So you're alluding to there's a limit. Words helped, but there was a limitation.
Yeah. So, OCD was a diagnosis that I sought, and it was one that I was eventually given. And along with that diagnosis came this framework of understanding of the nature of my problem. I thought of my experiences as symptoms.
Mm-hmm.
I thought of my problem as a disease.
Mm-hmm.
And that framework, in a sense, was helpful in that it sort of made me, it kind of relinquished any kind of internal sense of blame, because it's like, okay, well, if this is an illness, if there's a problem with my brain, then there's nothing I could have ever done about it.
Yeah.
And it sort of, because it gave me a tag, a label, it helped me connect to other people with problems of a similar nature. And we were all in this tribe according to this medical problem that we had. And in the book, I sort of, and in work that I did since, I sort of kind of parroted that medicalized story of my suffering. And then I sort of outgrew it.
Yeah.
Because, and that came when I started doing the deeper work with meditation and EMDR and psychedelics. And my sort of mind and heart and body were open to this world of pain that I never knew existed.
Mm-hmm.
Which, this is going to sound strange to anybody listening that's got OCD, because this condition is so horrendous and it feels so awful. And, calling it a disease makes sense metaphorically, because it's very, very, very bad. But it's, it's not a disease. It's not an illness like any other illness. There's no biomarkers. There's nothing you can look at under the microscope. There's no brain scans that can diagnose OCD. So then what is it? Like, what purpose is it serving? Like, why was my life destroyed by this incredibly powerful mechanism? And I don't necessarily have the answers, but I've started to chip away at the answer through psychedelics. And essentially it boils down to trauma. And rather than seeing my OCD as a disease and an illness, I now sort of see it as a kind of containment mechanism or a distraction mechanism or a protection from a bundle of pain that I experienced when I was a kid that was just simply too big to process.
Yes.
I couldn't handle it. And my system created this really quite ingenious strategy for saying, okay, I don't want you to go anywhere near this pain because this is going to overwhelm you. So go over there for 15 years and think about it and busy yourself with this Gordian knot of obsessions and compulsions.
Yes.
And that was quite a fundamental shift for me, because I'd been at war with my body and mind for a couple of decades, because, what kind of body and mind would, it's not fair to be born into the world with a disease like this. And, my diseased brain was bullying me and I just wanted to battle with it. And then with this new lens, I discovered this kind of wellspring of self-compassion. I now don't see my OCD as having been trying to bully me or destroying my life with this disease. On the contrary, I see it as having tried to keep me safe. And as it was a last line of defense. And I know that sounds really counterintuitive because it feels like an illness, but that's not the conclusion I came to ultimately.
Yes, I mean, it sounds counterintuitive, but in the mental health world, what we call a trauma-informed approach is becoming more and more common, where we're looking through many conditions through the lens of trauma, be it OCD, anxiety and depression, psychosis. That trauma is likely to play a big role, particularly even a condition like borderline personality disorder. When I diagnose borderline personality disorder, I often have a discussion with the patient, which is like, there's a reason you have these traits. These traits may have saved your life at one point in time. And the issue is now that you're an adult and you're in a different environment. and these traits are sort of clashing with your current world and causing you problems that way. But there is a method to the madness. There's a reason why those traits may have developed in the first place. And another analogy I like to use in physical health medicine, one huge problem, one factor that spans many different diseases is scar tissue. And scar tissue, if you get a wound, you need some scar tissue to stop the bleeding, to prevent infection. But a lot of diseases we struggle with in the West are a result of chronic scar tissue. So heart disease is scar tissue that's there for too long on the inside of the arteries. Or liver cirrhosis is scar tissue of the liver that's there for many, many years and disrupts the function of the liver. And I am starting to think of many mental health conditions as chronic scar tissue, something that came in response to some kind of, let's say, psychological insult with biological processes as well, but now is there for too long and disrupting our current interactions with the world and other people and with ourselves.
I mean, I think that works as an analogy. I mean, interestingly, we talk about physical and mental health as being separate, but of course they're not. And there's also a kind of a change in the ties when it comes to physical medicine as well. Yes. And a lot of physical conditions and the kind of sclerosis that you're describing is exactly. Like also now, possibly thought to be a result of trauma as well. But yeah, I mean, it sounds like your patients have been very lucky to have you, because I got through a couple of decades of mental health care, and nobody took the time to sit me down and say, like, you realize there's no biomarkers, there are other ways to think about your mental health problems. And when I sort of started to understand more about this, I felt very frustrated by that. I felt like that psychiatry had sort of pulled the wool over my eyes in a way. In that I'd been sold this medicalized view of my suffering. Yeah. And I actually think that thinking of my suffering as a disease actually obfuscated what was actually going on. And that was that there was unaddressed issues from my past that I hadn't lifted the lid on. I've interviewed quite a few psychiatrists and therapists and sort of discussed this problem with them. And various people have come back and said, but diagnosis and a medical framework and simple solutions and the idea of a chemical imbalance, these are answers that patients seek. And I absolutely agree with you, not with you, I'm not quoting you, with your colleagues. We do. Of course we want, we're struggling to survive. Of course we want simple solutions, but I also don't think it's good enough, to peddle this medicalized view of mental health just because that's what people want to hear. I don't think that's good enough.
Because I think there's a way that it could be used to maximize its advantages and hopefully minimize its disadvantages. Because it's a model,
it's a model. It is, but it is a model and it is used like that. But I don't think a lot of the public understand that it is a construct. A lot of people still think that that their mental health problems are primarily caused by by issues in their brain, and I don't think science has proved that.
I agree with you. I think the issue is it's a model that's not being marketed as a model; it's being marketed as reality.
Yeah.
And I think that's as far as I can tell the issue, as opposed to one way you could frame it is this is a medical way of understanding things, and here are the pros and cons, and there's still a lot of mysteriousness. That's one way of framing it. I think a lot of the ways it's framed unconsciously, I think, is this is reality. This is reality as it stands, and I think it's not even a process whereby clinicians are trying to be deceptive. I think they're just in it. They buy into it.
Yeah.
They're involved in it. It's their way of seeing the world. I think everyone is almost cursed with their way of seeing the world, and most people, I don't think, take the time to explore different paradigms.
Yeah.
But you explored lots of different paradigms, and now I'm curious, so you sort of went through the medical paradigm. It helped you to some degree, but clearly not all the way. What did going deeper look like for you?
Well, picking up after I'd had that non-ordinary state of consciousness while meditating, and I started to research into non-ordinary states. I learned then that people for centuries, maybe millennia, have been using altered states as a way of exploring themselves. And that was quite appealing to me. It was quite scary, but it was quite appealing. And I decided to sort of tiptoe into the world of psychedelics. And I should sort of just caveat what I'm about to say with, I don't recommend that anybody, not least anyone who's very seriously distressed, does what I did, because it's risky.
Similar to the silent retreat.
Similar to the silent retreat, except I would say even more so with psychedelics, because these are extremely powerful compounds, and you can get yourself into quite sticky situations with them. Equally, I think a lot of harm has come from overemphasizing the dangers of psychedelics. I think I wanted to know, my initial research was into the clinical trials, and I wanted to know if researchers had shown that they're generally safe. And I think that they are under the right conditions, and not only safe, but hugely beneficial. But obviously, it's illegal to do. I wanted to try magic mushrooms, and that's legal in the UK. I went abroad and I had a guided experience, and this was actually just in the wake of Pure having come out on TV. And when Pure came out on TV, it was almost like that kind of great placebo effect of having taken part in this amazing, big, beautiful project subsided. And I was just back down to earth with the reality. Having been celebrated for my redemption story, I was back down to earth with the reality of still having really terrible OCD and a sense of failure and fraudulence. And every day I woke up wanting to die, and I would have an inbox full of people telling me, thank you for showing us the way. And the cognitive dissonance was really quite overwhelming. So that was the context with which I went into a psychedelic experience. Not the best mindset. And I had a very, very difficult trip, I would say, a harrowing trip. A lot happened in 6 hours. I went to a lot of different worlds. Sort of notably, and first, I was propelled into this organic space where nothing existed.
What dose did you take?
I took at least 5 grams.
Oh my! Well, I believe that was one of the McKennas referred to that as a heroic dose.
Yeah, I didn't really feel like a hero. I went in big, and it was harrowing. I ended up in nowhere, where there was just it was just a world of churning textures in a kind of like a bluish hue, no shape I could recognize, no person I could recognize, no sound I could recognize. And I felt this sense of utter desolation, but it didn't feel that there was a me there to feel it. I had never existed. No one would ever exist or had ever existed. I was, I don't know if it was ego dissolution, but it felt like something close to that. And what followed in the trip was the surfacing of some traumatic material, not repressed memories or anything, things that I already knew, but for the first time I was feeling the physical weight of those emotions. And I sort of came to, and I just there's something in this that it was unignorable. It was almost like an epiphany, but not like a bolt of divine inspiration. It was like this uncanny sense of knowing something that I already knew.
Of a rediscovery,
of a homecoming into really quite intense pain. And, the dangers of going underground and doing it with guides that you don't know is that, I don't know whether I would have if I would have had such a rough experience in another context. There's no counterfactual there, but I was sort of scared off going down the guided route from that experience because it was so horrendous. And then I started experimenting on my own, which is definitely something I don't recommend people do.
You do a lot of things you wouldn't recommend.
but it's not like I don't want to make it sound like I'm trying to set myself up as some kind of avant-garde or anything. It's just more that I just want to be really careful. I don't want anyone to like replicate. Don't try this at home.
I mean, people should obviously understand the risks, and we're by no means prescribing a course of action. But what I admire about this, which is I don't see that often, is your willingness to, you have a set of problems and your willingness to dive headfirst into so many different schools of thought, so many different spheres to try and solve them. And I think not everyone has that courage to be able to do that. So maybe the specific actions we wouldn't prescribe, but the courage is admirable, and to do it yourself and to not put it upon other people to solve your problems for you, but to take that very autonomous position.
Yeah, I mean, it didn't really feel courageous. It just felt that I was fighting for my life. Yeah. There was quite a haunting diary entry that I wrote in early 2019 after the show had come out. It just said, "This can't be my life. Yeah. This cannot be my life. Like I can't. I can't." And in the wake of that very difficult psilocybin experience, I was like, "Well, what now?" And am I waffling?
You're not. No. I'm curious what happened next, because there's no book yet.
So I was just too scared to like trust anybody again in a guided experience. So I sort of read the MAPS protocols. This is the Multidisciplinary Association of Psychedelic Studies, and the protocols they use for guided experience in their clinical trials. And I replicated it at home in all ways, except for the fact that I was alone and I didn't have therapists with me. And what the series of trips that I did were just some of the most profound experiences of my life.
And were those lower doses, same dose?
I experimented with different doses, but I replicated what they use in the clinical trials, which is 125 followed by another half dose, a booster 2 hours later. Yeah. And maybe I can tell you about some of the specifics of those experiences.
Absolutely,
that really changed my thinking. And one of them was...
Sorry to interrupt. This is Tom Jones. And as a fan of the show, I'd like to encourage you to follow and subscribe wherever you listen. If you like the show, you can share it with a friend. And if you'd like to support the team, you can buy them a coffee using the Buy Me a Coffee link in the show notes. As always, they'd love to hear from you. So if you have any feedback, you can follow them on social media, or you can email the team at podcast@maudslearning.com.
So MDMA, they think it's very particularly useful in treatment of PTSD and complex PTSD. So essentially trauma. And it does a hell of a lot of things. But one of the things that it can do is it creates kind of like synesthesia. So it creates a sort of crossing of sense perceptions. And it sort of can turn your body into like a living metaphor in a really just astonishing way. And on one of those early experiences, I felt a vision in my body of me sort of like rising through the atmosphere at sort of breakneck speed in an incredible rush, which was like the coming up. And I suddenly sort of hit this wall of tension, almost like an asteroid belt of intrusive thoughts that were kind of hitting me like rocks as I continued to rise through the atmosphere. And it was sort of like all my worst fears and thoughts hitting me all at once. And it was absolutely horrendous. And I continued rising, and eventually I pushed through. I had this physical sense of pushing through that asteroid belt into this like wide open space of like ecstatic pain.
Ecstatic pain, that's an interesting phrase.
Ecstatic pain, of a kind of homecoming into the pain in my body, of something that had always been there that I had never accessed. So it was exquisitely difficult, but also exquisitely pleasurable at the same time. And as I was there meeting my pain head on in this beautiful wide open space, there were no intrusive thoughts. And I came away from that experience, like realizing like, fuck, like my OCD has been protecting me from that this whole time. So, you know, what we were talking about earlier in a kind of intellectual way is like OCD being like a barrier, like MDMA showed me that in a physical way in my body. And it helped me push through it. And, you know, I've had sort of countless similar insights on MDMA in particular that just gave me a completely new lens to see my suffering.
Yeah. So it's this. So you've had several experiences of discovering that perhaps the OCD was a protective layer over deeper pain, possibly deeper trauma, and then what happened next? Then were there attempts to address that trauma directly, to address that pain?
You can't get, you know, and one of the reasons why I want to speak about this is because it makes me so sad that you can't get this legally, and that my journey through it was so lonely. And I was basically just doing DIY and citizen science and trying to take bits from over here and bodge them together and sort of design a protocol. And, you know, I used my psychotherapist. I have an amazing psychotherapist and EMDR therapist. And I sort of used her as a sounding board. You know, she didn't necessarily condone what I was doing and she wasn't a psychedelic therapist, but I used her as a sounding board and as a way to kind of integrate what was coming up in the trips that I was doing on my own. And that's a sort of, I think that's less than ideal. Like, you know, the models of psychedelic therapy that are coming out, that maybe one day you'll be able to get prescribed on the NHS, I think would be at least one, if not two therapists sitting with you while you do the drug. And then those same people being the people that you talk to before and after the experience to integrate what comes up. But, you know, I didn't have that. And it was a massive struggle to get anything close to that. But did you ask me a question? I can't remember.
I'm wondering now about addressing the trauma itself.
Oh, you did. You said about pain, how did I deal with the trauma?
Is that something that's still ongoing? Is it a work in progress?
I think I don't want to say that will always be a work in progress because I don't feel like that anymore. Like psychedelics actually gave me the sense that like, oh, I'm not going to be wading through this forever. Like,
you used the phrase in your book, a phrase I liked, which was fucked up in a manageable way.
Yeah.
And aren't we all just trying to be fucked up in a manageable way?
Yeah, exactly. And I think I was fucked up in a manageable way at the time until it wasn't manageable. And now I just don't feel fucked up. There's the difference. But yeah, in terms of like what I did with the traumatic material that was coming up, you know, psychotherapy was a part of that, but also life. You know, I think psychotherapy is important, but realistically, I think the answers to your problems are not going to be found in an hour a week speaking to somebody on Zoom. I think it's about giving your body a sense of safety and achievement and accomplishment and mastery in everyday life as often as possible. And, you know, regular practice, regular meditation practice, regular yoga practice, dance, friends. It wasn't one thing, but the psychedelics just brought down the temperature on all of my fear and made all of those things start to feel much more enjoyable than they ever had.
Yeah, so I guess the takeaways are that it's lots of different things, lots of commonsensical things like friends, meaningful activities, engaging with your body. And even though you had punctuated moments, epiphanies, moments of clarity, there is like the sense I got from the book and from what we've been saying today is there's also a sense of incremental progress. It's a kind of chipping away and occasionally, you know, you can think of like an archaeologist chipping away and occasionally you break into like a new room or something like that. And that sounds like how it was for you.
Yeah, very much so. Very much so. And, you know, at the heart of everything that helped was relationship. You know, I think the idea of the kind of hero's journey out of trauma is a bit of a myth. I think, you know, all trauma in a way is social trauma. Like we're not islands. And we develop trauma through relationships and we also heal from trauma through relationships. So yeah, it was about engaging with people as much as possible. That was the most helpful thing.
Yeah, I agree. And there's a lot of schools of thought of psychotherapy, like relational psychotherapies, that work on that idea that if you had an early life environment where you had relationships which were dysfunctional in some way, inconsistent in some way, it is then through a relationship that can be addressed. And often it's implicit, like the kind of relationship you can develop with a friend or romantic partner or even with a therapist. It's not them imparting new knowledge or giving you education about attachment theory, although I think that stuff can be super helpful. It's the actual implicit, I'm okay, you're okay paradigm that can help people to gain a new sense of social confidence.
Mm-hmm. Yeah, exactly. And when you start to feel that, just like really simple things, just like, I've got little nieces and nephews, and just like being able to really engage with them and like feel what it's like to like resonate with another body. It's like, it's a really beautiful thing, but it also comes with this sense of grief. Because I didn't have that for so long, because that's exactly the thing that OCD was too scared that I experienced, because I didn't want to get hurt. So do you think then that your OCD was kind of like a barrier to intimacy because you were on some level weary of the pain that intimacy can cause? Yeah, exactly. And there's nothing new about that idea.
It's new to a lot of people, I think.
Yeah. I think
most people are in the double bind in that they really want intimacy, but they're terrified of engaging in the process that it would require to take it, to attain it. And I would think of something really common like gossiping. Like if you and I, instead of having this conversation, which is quite, I'm asking you some pretty invasive questions, but we could just be sitting gossiping, and if we were gossiping, we'd be getting a bit of a dopamine hit from that. We'd be feeling good about ourselves in terms of status and relationship to others, but we wouldn't know each other any better. Mm-hmm. And I think we engage in all sorts of activities, be it gossiping, be it drugs and alcohol, be it distractions, because we're scared of that intimacy. But then we end up in a world where we all feel a lot lonelier, I think, as a result.
Yeah, I totally agree. And the loneliness comes from, there being huge parts of ourselves that are not being allowed to exist. The way, we've been talking about mental illness as a construct, like another construct that I found really helpful is this idea of the inner child. That's a metaphor. Obviously, it's not a literal thing, but, I think I was carrying around with me this profile of emotions and physical sensations that had been locked away in the past for a long, long time. And maybe I could tell you about when I first met my inner child on psychedelics, which was another one of my MDMA experiences. And that I sort of found myself as a however old I was at the time, 33, as a 33-year-old woman, lying on the bed in my childhood bedroom, feeling this just immense like weight, this like pressure on my whole body, and not understanding what was happening. And then my 13-year-old self like sat up from my grown-up body, and she got out off the bed, and she turned around, she smiled at me, and I said to her, I had no idea you felt this pain. I'm so sorry, I didn't know. And I said, I can feel this pain for you now. I'm sorry I wasn't there, but I'm here now. You're free to go and play. And she smiled at me and she skipped off.
Wow.
And I lay there as both a 13-year-old girl and a 33-year-old woman at the same time, feeling both her joy and her pain in my grown-up body. And like, that's almost like a perfect encapsulation of integration, of bringing past emotions into the present. And, from these kind of experiences, I set up like a main line to that past version of myself that, I was in contact with her. I hadn't been for years. And, I was able to say to her, it's okay, you're allowed to exist. Like, you're allowed to feel however you feel. And that I think was the key to the liberation. And it the impact that had in my present day was that my inner voice was just infused with compassion. Like I didn't hate myself anymore. I was like, you were just a kid. Like, it's okay. Like I've got you.
Wow. So it was recognizing that you're not one thing, that there's a plurality to your existence, and to develop a more harmonious internal world, whereas previously you might have not even been aware of that plurality, and it was disharmonious totally unconsciously.
Yeah, absolutely. And this is where good psychotherapy can come in to psychedelic integration, because a lot of the insights that come up through psychedelics map quite closely with modalities like parts work and IFS, for example. This idea that we're not just one fixed self, that we have lots of different inner selves that are sort of all competing and all trying to protect their own integrity. And we can sort of, we peel back the layers and listen to what that inner child says, or what that manager part says, or what that firefighter part says, then we might learn something. And the problem is with talk therapy, it can take a really, really, really long time. Whereas MDMA just gets there.
It's a catalyst.
It's a catalyst.
And, even in kinds of therapy like person-centered therapy, they recognize you have an internal configuration with different parts of yourselves, and transactional analysis, which recognizes the child ego state and help develop a better relationship between your parent, adult, and child ego state. So it's a recurring idea, I think. And what I am really excited about with psychedelic therapy is it's a combination of a biological and a psychological intervention. So the doctor in me and the psychotherapist in me is quite happy. And it seems to be that these drugs, through whatever mechanism, allow a window of opportunity for change. And in psychotherapy, what we think of a lot is a movement from rigidity to flexibility. And it's like psychedelics allow for a window of opportunity to gain more flexibility. Yeah.
And also, in neurobiologically, they also think that's what's happening as well in terms of like the connectivity that is created in your brain. There's sort of the rigidity in those neural connections like relaxes somewhat, which is why you can think about things in new ways. I think the neuroscience is really important. I don't think it necessarily captures the essence of an experience.
It's a one lens into it.
It's one lens into it, and I think it's going to be a big part of the future of mental health care. But I also think, as well as the science, poetry and art and music are equally important, and that's another thing that psychedelics does, is it brings those elements in. To give you an example from my experiences on psychedelics, that sort of ego dissolution state that I described on that first psilocybin trip, I really didn't know what to make of that. And I'd sort of read about, maybe it was a change in the activity of my default mode network, and that's what accounts for, but that doesn't, it's interesting, but that doesn't get me anywhere.
It doesn't capture the totality of the experience.
It doesn't. And then I was reading some Carl Jung, and he made a description, he's all about the catabasis, the journey into the underworld. And there was this phrase that stood out from his work of the night sea journey. And it kind of stopped me. It sort of made the hair stand up on my arm. I was like, the night sea journey, that's exactly what it felt like. That space that I didn't have a word for, that I thought was nowhere, this rushing organic space. Art and poetry, they give us a way in to the mind.
Especially the first person subjective experience.
Yeah, exactly.
Have you come across the work of Ian McGilchrist?
I have, yes. He's another one. He really brings together the science and the art. And what I really like about his work is that he's sort of, he's a psychiatrist, right? So he's a big proponent of science, but he sort of almost despairs at the way that, science is always trying to iron out the I and the subjectivity. And you can't, almost by definition, the mental experience is a subjective one. You can't iron it out. And the meaning that I make of my experiences, that can be brought into part of my healing. It's not something that needs to be eradicated.
Science is it's obviously a tool it's a powerful tool. It's based on rationality, but if used improperly, science can fall in love with its own achievements, or the scientists can fall in love with their own achievements, and it can become an encapsulating totalitarian way of looking at things. And I've watched some lectures which kind of psychologically analyze biblical stories, and there's some really interesting stuff. Like even if you look at the origin story of Satan. So the origin story of Satan is Satan was named Lucifer. He was the highest angel in God's kingdom, and Lucifer means bringer of light. And they think that what that symbolized was that Lucifer was kind of a guide towards rationality. He could cast light on things and help things be seen, much like science helps us see things more clearly. But Lucifer fell in love with his own inventions and with his own designs, and he thought, why should I serve God? And I think you could think of God as this like appreciation for greater mystery, let's say. Let's use God like that, an appreciation for greater mystery. And Lucifer was like, fuck that. Like, I'm going to rule. And obviously he fell from grace and was banished to hell. And I think that's a really compelling way of thinking about things. If you fall in love with your model of your view of the world excessively, it becomes totalitarian by nature. And it's very important to maintain a sense of intellectual humility and to appreciate our perceptual systems, our cognitive systems are limited. There's stuff outside, and we are always the servant of that greater mystery.
Yeah. I mean, I think that would be one of my main critiques of psychiatry, and that just, it historically hasn't been particularly humble and hasn't been particularly upfront with the public about how little we've discovered about the mind. Like, it's not like other branches of medicine. Diagnosis doesn't mean the same in psychiatry as it means in other branches of medicine.
And even in other branches of medicine, there are things I think it can be portrayed as too certain of itself.
Yeah, absolutely.
One word I found really useful is the word mystery or mysterious. When patients or their families have asked me for certain answers, I think too many clinicians fall into the trap of like not giving straight answers and not admitting to the fact that a lot of it is mysterious. And when I use the word mysterious in the clinic room, often there's a sense of relaxation of like, okay, I can trust this person because he can admit he doesn't know everything. And it's not down to me and my pathology, but there are just things we don't fully understand yet. And that's in a strange way a bit liberating.
Yeah. It's you can relax around someone if they're just honest about how much they don't know. I think that's a really admirable trait, and it's not something that I've experienced much in when I've been sat opposite doctors talking about my OCD.
On the other hand, another story which is a counter to this is sometimes psychiatrists can be not as assertive as they should be, and people crave answers, and we can be a bit shy. I remember one story where we were seeing a 21-year-old male in hospital who had kind of all the textbook signs and symptoms of a manic episode, and his mum was there and she was despairing. She's like, what is this? What's going on? What's likely to happen? Do other people suffer from this experience? And for reasons I'm not sure of, the consultant was very shy to name it, to say this is what it is. It's probably a manic episode. It tends to follow this kind of course. There are these kinds of treatments available. This is the likely prognosis. And of course, caveats aside that there are uncertainties, I could tell that's all she needed to know was we have a little bit of a grip on this. We have a bit of an understanding, and we can help in this, that, and the other way.
Yeah. Yeah, I mean, yeah.
So it's kind of, it works both ways, I guess. It's the pros and cons, I guess, of using frameworks to think about things.
Yeah, and there's no perfect framework. No. There's no perfect framework, and it's natural that we want authority figures to explain things to us. Like that's the most, that's how we came into the world, and needing that reassurance. But I think if you can, especially when psychedelics are legalized, which I think they will be for therapy, like I think grasping things lightly is going to be like a really essential skill for people.
Absolutely.
Because these are inherently mysterious experiences.
Absolutely. And one other way of thinking about it is today's revelation is tomorrow's crutch. So as you're moving through a very difficult journey, like you have, like we all do in our lives, it's very important that when you get that high of epiphany and you realize, oh, I've broken into new territory, you have to keep moving.
Mm-hmm.
It's a dynamic thing. It's not a static thing. And that the things that make us feel amazing today and we feel are giving us revelatory answers today, tomorrow might start to hold us back. And so the search is a kind of ongoing one.
It is, yeah. And I'm sort of, as you know, especially cognizant of that since Pure, and that I think, you know, when I was writing that book, I wanted answers, and to some extent I thought I'd found them.
Yeah.
And I still want answers, and I'm still looking, and I'm discovering some very interesting things in the work that I'm doing, but I'm just trying not to place too much weight on them. And I made the mistake in the past of thinking that I'd finished a story, but actually it was just the beginning of another one, or a continuation of the same. So
what's you working on now?
Well, so I'm writing a book about all of this stuff, and I'm a screenwriter as well, so I'm going into the second season of a new sci-fi show that I'm writing next year. So I'm busy, but in a good way.
Well, I mean, I'm looking forward to all of the new work you produce. I'll be sure to read your second book. Anyone that's interested in OCD, definitely check out Rose's first book, Pure, and the Channel 4 series, Pure, as well. Rose, thank you. It's been absolutely wonderful to speak to you. Would love to have you back on the program at some point in the future.
Thank you, Alex. It's been a real pleasure. Let's do it again.